Hi, and welcome to our latest edition of Tush Talks. We're here with Colorectal Cancer Canada, Canada's national patient advocacy group for colorectal cancer patients, and I am your host, Carl Binman. Tush Talks are a chance to share expert perspectives on issues facing colorectal cancer patients, families, and caregivers for free on the internet as a webinar. It's a wonderful service we provide, along with many others. You can find out at colorectalcancercanada.com. Our guest today, we're very excited to have Dr. Brooke Fletcher with us. Dr. Fletcher is a clinical child and adolescent psychologist and a pediatric health psychologist. She obtained her PhD from the University of Toronto and completed her residency with the Alberta Children's Hospital Pediatric and Child Clinical Psychology Program. Dr. Fletcher has over 15 years of experience providing psychological services to children, adolescents, and their caregivers in various settings. In 2022, Dr. Fletcher founded Popple's Psychology Services, a private practice where she provides both in-person and virtual psychology services. She is a registered psychologist in the provinces of Ontario and Alberta. Brooke, we're super happy to have you for today's Tush Talk on the impact of a cancer diagnosis on a child. How are you doing today?
I'm doing great, and thank you for inviting me. I'm really happy to be here.
We're happy to have you. Let's jump kind of right in. So let's say I am a parent and I have just received a cancer diagnosis and I'm struggling. Do I tell my child? What are some factors that I would want to be thinking about in terms of knowing which side to come down on there?
Yeah, and I think that's probably if you are a parent or a caregiver and you have children in your life and you are given the news of a cancer diagnosis, I think that's one of the first things that might pop into your head. And I think a lot of parents wonder, do I or don't I tell the kids or the child? And I think a lot of the times as psychologists, when we're helping families go through this, we hear, maybe I shouldn't tell my child. I don't want to upset them. Maybe it's best that we just leave this as a parent issue, or perhaps, even the fear of, am I going to abruptly stop childhood because it's such upsetting news. And so as a psychologist, I have to say the research is pretty clear on this one. And the research shows time and time again that levels of anxiety in children who are told about the cancer diagnosis are much lower on average than children who are not told. I think you have to remember that cancer is a very difficult secret to keep, okay? And kids are anxious when they can feel something going on in the home, they can feel sadness, they can sense something is wrong. I think it's also very hard and it's inevitable that if someone in the household has a cancer diagnosis, a parent, that a child may overhear, even if they're not just picking up on the more like abstract what's going on, feeling different changes in stress in the home or sadness, that they can definitely, there's the chance to overhear. And what is definitely more difficult for a child is overhearing it when they don't have a parent to help them through and process that information. So if a parent is thinking, do I or don't I tell a child, as a psychologist, with keeping children's their best interests in mind, is absolutely that we need to tell children and we need to help them through this because we know they will do better overall.
That's really good to hear. How then is the sort of best way to keep a child's interests at heart and still share this information with them in a way that like would help them process or understand?
Yeah. So I think even backing up first is you don't have to immediately go home and, from that doctor's appointment and sit the kids down. You can take some time to process it. I think that is probably what's best. Sharing the news out loud, that even saying the word cancer at first can be very emotional for some people. And you want to give the parent time, the adult time to talk that through with other adults, to even practice and rehearse and being able to say that. And so I would first encourage parents to take some time and process that on their own. Take some time to think about, what you want to tell the child, maybe even rehearse it a little bit, talk with a friend, and kind of process your own. Of course, we want to tell children, especially older children who, again, might sense something is off or overhear things. We want to tell them sooner than later. But also, first take some time for yourself and to kind of think through that and who you want to be present to support you in that and kind of what your main goals are. And then, so if we go into, what to do or how to do this, overall, I think one piece of advice that I would have is think of this as a process. So this is not we're going to come home, we're going to sit down, we're going to have one conversation, and then we're done having this conversation. This is a process. This is going to be doses of information over time. It's going to be family meetings where the topic or what the focus is will change throughout the course of the cancer journey. But that first conversation in general, what you are kind of thinking about and what your kind of goals are is to give some information about the diagnosis, about the cancer. So again, we want to use the word cancer. We want to put a name to it. We want, if we say we're sick or we're ill, it's a little too vague. And so we want to name that we have cancer. We want to talk about what type of cancer it is. For younger children, that might be just about where in the body it is. For older children, they might know you've had some doctor's tests and things like that. And you can start with, that I've been to the doctor, I've had these scans done, or, I went for a colonoscopy or what have you, and now we have the results. And then you want to talk a little bit about, what the child can expect. And so again, in that first conversation, it might not be, what they can expect is there might not be any changes in the next week or the next month. Or it might be that this is our treatment plan. This is how we're going to go about it. I've talked with my healthcare team, and this is what you can expect over the next little bit. So we want to give the child some information about what to expect in their world. That might be some availability for the parent, like I won't be able to pick you up from school next week, or those type of things, or you might see that I'm a little bit more tired. Again, if treatment is starting right away, we want to focus on some physical changes that they will see to help prepare them for that. So we, especially with younger children, so focus on some of the symptoms that they might see to give them some preparation. And then you want to, in part of that conversation, spend time on feelings, on concerns, take a pause, let them know a little bit about how you're feeling. So you can say, I'm sad about this. I don't want cancer. I wish I didn't have cancer. And it's okay to feel sad, and ask them a little bit about how they're feeling. And just encourage questions. And that usually we like to provide some reassurance as well in that first conversation. So some of that can look like, I will let you know if anything changes. I will let you know the updates. But we want to make sure that kids know that you'll be continued to be looked after. You can continue to talk and ask me questions. Those type of things for reassurance. So kind of, information about the cancer itself, what they can expect, both in terms of changes they might see physically or changes to their routine, and talking about feelings and concerns.
Yeah, that makes a lot of sense. Something that I'm curious about is, why is it important to specifically name cancer? Like, why is that so? Why can't you be vague? Why is the specificity important?
Mm-hmm. The specificity is important for different reasons. For younger kids, if we say that we are like trying to, in words they might understand, this might how you might introduce it and then move on to teaching them a little bit about cancer. But if we use words like mommy has an illness or mommy has a boo-boo. That's very confusing to them. They might think, okay, well, let me just get you a Band-Aid, and not have a sense that this is different. And for older kids, too, when you use the word cancer, I think it's really important as part of, especially that first conversation. So even kids 6 and upwards, you want to spend time on, what do you know about cancer? What have you heard about cancer? If it's something you haven't as a family experienced together, they might know from someone at school, they might have seen something on TV, they might have heard other people talking. And so it's really important to name it, but also hear from them what their already beliefs are about cancer, so that you can correct that. Or we do know, there is some research that if kids have had a previous experience with cancer and it has been significantly serious or terminal, or there was a negative experience, that can just affect their adjustment. So we want to name it, but we also want to know what they already know about it.
In terms of like affecting the adjustment of the child or the development of the child, I think that's a concern for a lot of people that we hear from, is like, will this traumatize my child, or will this like cause behavioral problems? What is your experience or knowledge about like how kids are able to cope with this huge thing happening to their parents?
Mhm. Yeah. So, cancer is a family affair. It affects everyone in the family to some degree, and it will affect people differently. So, for most families, it will have some impact on their child. That being said, I think we really need to remember, because again, that's that fear of, do I tell them, what's this going to be for them? I don't want to cause them any emotional pain. I don't want to, cause them anxiety disorder, what have you. So a couple things to know about what we know about kids who have a parent or a guardian with cancer is that although they are at an increased risk for some emotional stress or some behavioral changes than children who don't have a parent with a serious illness, we know that the rates of what we would, as a psychologist, call a clinical diagnosis, like a anxiety disorder or trauma disorder or depression, the rates of very few children develop that. So most children cope just well when we're looking long term.
So it seems like a kind of a theme that's emerging in how to talk to kids about this is like honesty and transparency. And the thing that I am struck by is when I was much younger, one of my parents had cancer, and then when I was like slightly older, the other one of my parents had cancer. But when I was so young, I didn't really understand what was happening to my parent. And like this communication, I think, was very helpful for me. When it's a guardian that isn't necessarily a parent, but somebody that the child knows really well, like an uncle, an aunt, or a close family friend, where does the sort of disclosure question fall when it's like somebody else's illness that's not in the immediate family, but that could still strongly impact a child's experience?
Mm-hmm. Yeah, I think again, information is always best, right? So if a child, for example, has an aunt or uncle who has a diagnosis of cancer, and maybe they are more fatigued, or and they have a visit with them and they can just tell something's off, or that might not have the energy to interact with them in the typical way. Children who are young are very, and this is very developmentally normal, but they're very egocentric in thinking. They're very about themselves, right? And so it is very, very, very common for a child, when they sense something is off, to attribute this to themselves. And it's something I did, or they're not interested in me. And so having that information, so they don't have factual information, know that actually, Uncle Jimmy has an illness called cancer, and we explain a little bit about what that is. It's making him more tired. He is happy to see you. He just right now doesn't have the energy to play ball with you or catch with you. That is going to help a child. When we have missing gaps in our knowledge, for a child, they usually fill it. It's usually something that it is about themselves, and it's a lot of the time it can be much more distressing how they feel that information than what is actually going on. I think too, for this, this broader conversation, when we talk about hard things with our kids and when we help them through, we're really parenting them and giving them coping skills for life. Whether it's a parent or whether this is an extended family member, you are helping your child for how they are going to approach very hard things in life. Are we going to avoid them and we're going to all deal with them inside ourselves, which is going to increase our risk factors and we can talk about more specifically, what are the types of behavioral or emotional things to look out for when we talk about that increased risk. But by talking about these hard things, you are giving your children a gift in terms of coping throughout their life. And so when we think about an extended family member in that first conversation, what I was talking about for the details, it might not be that it might be more about what you can expect to see and how that might change in your relationship, and especially about our feelings about this, and that it's okay to ask questions, but they probably don't need the same level of detail, and they're probably not as concerned about what does this mean for me in terms of my life, like who's going to care for me, or who's coming to my recital, or those type of things that a child is very common when they hear a parent diagnosis. Especially younger kids, there's a lot of questions about who's going to care for me.
Well, let's talk about what you brought up there of when you do have a child who might be exhibiting concerning signs of a developing anxiety problem or depression. How do you recognize that as a parent and try to help either head that off or support them through their experience as a child when they're having these difficulties?
Yeah. Okay. So it might be helpful if I run down a little bit of what things to look out for, and then overall how we can support kids through this challenging time. So, even for infants and toddlers who don't have words, and you're not going to sit them down and have a conversation, of course, with an infant about this, they too, though, can sense changes. They can sense changes in the availability of a caregiver, if there's hospitalizations or changes to routine, or they can even feel the stress in the environment. So something you might look out for with an infant or toddler is more increased fussiness, more colicky, difficult to soothe. You might have, regressions a little bit. Maybe they were sleeping through the night and maybe they're not, or maybe this can happen in preschool aged kids as well. But when we think about regressions, they might, for a period of time, start going back on and losing some skills they had, like wetting the bed, or wetting themselves during the day, or sleep disruptions, or things like that. You might see some behavioral outbursts for preschoolers, and you might see more clinginess, more separation anxiety. They don't want to be away from mom or dad. For school-aged kids, some things you might see especially are stress coming out through physical symptoms. So you might see a lot more tummy aches, you might see more headaches. You might see, again, for toddlers or preschoolers, when they are overhearing things or they are seeing things that are different, you might see that play out in their play or in their drawing. So there might be a lot of play with dolls around someone being sick, and we have to give them medicine. And then, kids who are at school age, you might hear from the teachers that they seem a little bit more distracted at school, having a little bit harder time concentrating. Or you might just hear it in worries, asking a lot of what if questions, especially in that first conversation. If a child has had exposure to the word cancer or what it means, a lot of the first time question is, will you die? And I think parents to know that that is a very common question. It's a very typical question. And it's, it goes back to as well that who's going to look after me, that fear of abandonment. And so if you do hear that question, it's not at all a sign that your child is any more distressed with the news, or it's a very common question. So anxiety informs the questions. You might see, again, with teenagers, tend to have a capacity to start abstract thinking that younger kids don't have. So the teenagers start thinking about this in terms of the future, in terms of what will this mean for even myself? What is my cancer, risk factors? Or a lot of times too, I hear from teens that they worry about their healthy parent and how they're coping as well. And then you might also see, again, you might see kids that just kind of shut off. They don't want to talk about it. They say they're fine. They get irritated when we start talking about it. And again, that's their way to cope, and that's their way to protect themselves. And I think that's quite normal too sometimes.
Yeah. So then if you have a child who is like, say a school age child or a high schooler who they are showing that they're not maybe coping in the most healthy way, like what are some strategies that are, within the possibility of somebody who's also fighting cancer? Like what are some ways to help the child find a better way of coping or get support?
First and foremost, creating that space for feeling conversations and talking about feelings. And so creating the opportunity, and sometimes, especially for those kids who are just not ready yet, and it's going to take them time to adjust to the news, and we don't want to force them to talk about things. Sometimes just creating that space is as important or more important than having the conversation, so that they know that you're there when they are ready. And so that can just be like, checking in and saying, I want to know how this is going for you. A good question always is what is the most difficult part for you, so that you can identify, what is at their top of their fear list, and creating different opportunities. I know lots of teens who feel more comfortable texting their parents. And so especially the hard questions, where they're a little bit worried about upsetting a parent with a question, but they feel more that, the age of texting, they're more comfortable through that medium. And that might not be how the conversation stays, but that's how the conversation sometimes starts. So finding different ways that sometimes maybe that one-on-one is too emotional sometimes for a child. So we definitely want to keep communication open. And when we look at protective factors and what actually protects kids from some of the more emotional difficulties, one is open communication. That's, again, something that comes up time and time in the literature. Sometimes too, you want to identify someone in the child's life, another adult, whether another parent, or if it's a single parent household, an extended family member or a teacher or a coach or a counselor that they can go to if they have questions. Because again, sometimes kids, again, teens particularly, it can be common that they don't want to upset their parent. And so having a contact person that they can go to, and that they can, that we know it's okay, you can ask this person any questions, and if you need to talk to someone. So just when they do share their feelings, we want to normalize that. We want to say, that's very normal for kids to feel, validate their feelings. All feelings are okay. And really just encourage healthy ways for them to express that. So again, whether that's getting their emotions out through talking or physical activity and releasing built up stress. Some kids love through art or music or their sport. And so just trying to encourage healthy ways to release stress. We also want to try as much as possible. Again, there's obviously challenges that come up, but to keep the routine as normal as possible. So kids, again, thrive for a sense of safety and security when the routine stays as close to normal as we can. And with that, we want to encourage them and let them know it's okay to still have fun. Yes, our family is going through something stressful. Yes, this is sad, and it's okay to still be a kid. And I encourage you to still be a kid. So if I can't drop you off, I'm going to call on our support networks and make sure that you still have those outlets and you can still have a good time and, laugh and have fun, and you don't need to feel guilty about it. I think supporting kids also includes, especially for the young kids, talking to the school, letting them know what's going on in the household so that teachers can be on the lookout for some of these changes that they may see, and provide more extra, attention or comfort, or, calm down space if needed. For older teens, having them, give them some choice. So, an older teen, I would encourage a parent to ask them, do you want the school to know? Would that be helpful for you? Some kids don't, and they want it as an escape. In a teenager, I would encourage you to respect that and give them some choice and autonomy. But if they do, like, who could we tell? What would we tell? What are you comfortable telling or not? Is there anything at school that is hard for you right now that we could ask to see if they could help out with? And then also, if we look at, sometimes kids really do well with helping out. So if we give them like a way that they can help so that they don't feel helpless, and what they can do to help out. Now, we want to be careful that we don't parentify them and give them adult responsibilities, but still, giving them a sense of what they can do to help out with what our family is going through is sometimes really helpful. And then, of course, if you're seeing some of those, if you are seeing some of the more emotional changes, behavioral changes that are sticking around, they're quite distressing, or they're really impacting relationships, or they're impacting school or sleep, reaching out and, with a counselor, a therapist, a psychologist, or if there is a lot of, cancer care networks have groups for kids or support groups that can often be very helpful. I think, just before I wrap up, what can be helpful, just thinking in terms of what we know from the research about what protects what kids, who does better when we go through something stressful like a parent's cancer diagnosis. So that's the open communication, that's having close time with family members, social support from others, opportunities to escape, and having more of an organized household when possible, and really like active coping rather than just, I'm going to distract myself from it, or I'm just going to pretend it's not happening and just get through it. Yeah.
Those also seem like good tactics for an adult.
Absolutely.
And we kind of alluded to this earlier, and it's, the hardest thing in these sorts of situations is sometimes there is a terminal diagnosis. Mm-hmm. When that is what you get back from the doctor, how does that change the the disclosure, the expectations for the children. What does it mean for kids?
Yeah. And that's going to be, of course, one of the most challenging things for a family to go through. And one of the most, emotional, probably, conversations, but it can still be done. And I think to respect that the dying process is going to be a very personal experience, right? And so families are going to do this differently, and it's going to be different from every family, and that's okay. Again, above all, children want to know that they are loved and that they are going to be cared for. So keeping that in mind when approaching this. Ideally, this is going to be a gradual process, right? Ideally, and in a lot of, like, most scenarios, this is something we've talked about this. We've had that initial, cancer. We've talked about how treatment's been going. We've talked about what the treatment plan is. We might talked about that certain treatments haven't worked, and they're aware that they've seen changes in their parent and gradually come to terms with that. And then, for most kids, again, when we look, especially adolescents, when we look at adolescents who have had a dying parent, the vast majority of them want to know. Even though they know these conversations are going to be hard, they want to know in advance. So, that might start with, we've tried X, Y, and Z, and the doctors say that the treatment hasn't worked and there's no more treatments, or that the cancer has spread and there's no more treatment. So now what the treatment is going to be is my pains and aches and keeping me comfortable. I think, again, this is going to be ideally after a parent has had time to cope with and process that themselves, with their support network. Sometimes parents say, no, I can't, it's just too emotional, I can't have that conversation with my child. And I think too, we have to respect the parent, and then someone might help come in and have that conversation with the child, whether it's the other parent, whether it's, again, someone on the healthcare team, whether it's a counselor. Ideally, having the parent with a terminal diagnosis present. If they can't be, it's just too much pain at that time, then, letting them know that the child know why they are absent. This is really difficult for them and they wanted us to let you know. And there will be an opportunity for you to talk with them about it once they have dealt with their emotions. But yeah, that's extremely challenging. It's going to look different from every family. And ideally, it's going to be a process. It's going to be over time talking about, okay, treatment goals have shifted, acknowledging emotions about it, acknowledging what this means. Again, at the first conversation about, what you can expect, what this is going to look like, what our plans are from here. And that we will, if death is not imminent in the next, few weeks, you can let them know, like, I'm not dying now. We are stopping treatment, but we will keep you updated on things, and really shifting, again, with support from teams, because, again, this is a very stressful time for families, but helping shift the focus to making memories, talking about, connections that will last in different ways than physical connections. And so helping families through that. And I think, calling upon, it's going to look different from every family, again, with calling upon, your spiritual religious views, how you incorporate those or you don't. So it's going to look very different. And And again, it's going to be gradual. And with all these conversations, it's important to know it doesn't have to be perfect. Okay. You can tell a little bit of information. If it doesn't go so well, you can come back to it and address that. That last time we talked, I know that you got very angry, and I think I want to explain things a little bit different, or I wish I had said this. It doesn't have to be perfect. You can go back to things and redo.
Thanks. That's really interesting. And it is hard. It's hard. So it's good to have the perspective of somebody like you. On that note, kind of as a final closing question, in your role as a child psychologist, what kind of help are you able to provide? Like, why would a patient, a cancer patient, or them and their family be like, I'm going to go see Dr. Fletcher? So you want to tell me a little bit about your work in that regard?
Sometimes it's that, the initial question of do I or do I not tell my children. It's too emotional for me to even think of telling them. And so we talked through a little bit about that, what it would look like. Again, we want to tell the truth, but we don't have to give all the details. So it might be a session about, okay, well, what should we say? But maybe what are the details that are too much for your child's level of development? And they won't actually understand anyways. So sometimes it can be around that, especially too, sometimes parents disagree. They're not on the same page. One parent wants to tell and thinks one should know, and one parent's like, no. So sometimes coming to see a psychologist is parents first figuring that out, sorting that out. Sometimes it's, again, having that person outside the family who's not emotionally involved to be a safe space to talk through feelings. And so that particularly adolescents know that they can ask whatever questions they have, that maybe they are afraid of upsetting a parent, or that someone can help the family have those conversations and say, look, it's okay. It's not, the conversation didn't go nearly as bad as you think, and you can cope way better than you realize. A lot of times too, it's helping kids identify and challenge some of their thoughts that are inaccurate. So if we go back to that, it's about me or something I did, it's very, very common with illness and serious illness that I see a lot. And I see this from kids that young as 6 to as old as, even teenagers, where they attribute this to themselves. So for example, had I only been a better daughter, mommy wouldn't have gotten cancer. Or had I not had that fight, daddy wouldn't have got sick. And so sometimes it's around helping them express those thoughts that they're having and helping them correct them, and just talking through that. And then adaptive coping skills. What do we do when we are so angry and things are so not fair? What do we do when we are grieving the loss of a healthy parent? Or what do we do when when we are just very, very sad and we feel like we can't cope with the uncertainty, when we ask, we don't get all the answers we know, because mom and dad don't know the answers. The health team doesn't know the answers for sure. So sometimes it's just helping and coping through things like that.
Wonderful. Well, I'd like to thank you for joining us today. This has been interesting and emotional and really rich. If people do have questions for you, where can they reach you?
So you can find me on my website, www.popple.ca, and that's where my private practice information is, and contact information is on there.
Groovy. And on our end, you can find us at colorectalcancercanada.com, and you can reach out if you have questions or need support, or just need to talk about your colorectal cancer diagnosis or caregiving or anything that you need in that area at info@colorectalcancercanada.com and support@colorectalcancercanada.com. I've been Carl Binman. This has been Dr. Brooke Fletcher, and thank you for watching our Tush Talk. Have a great day.